We good in Grantsville?
Yep.
We're good on Facebook, Instagram, awesome. Okay, so it is 6:29 and 34 seconds. We'll wait a few more seconds because we said it was a 6:30 start, but we wanted to make sure that we had everything on and everything going and all of our IT stuff going, because we have had IT glitches in the past, and so we want to make sure everything's good. Give people a minute to sign on, log on, that maybe signed up, that are looking forward to this. We don't want to get too carried away too quick. So,
Can I say hi while we're waiting?
nope,
Okay.
no highs from Brian. But we'll wait. Yes.
Hey, so hi, I'm Brian. I'm from the Grantsville Clinic, and I'm happy to be here today. And you guys are right, the acoustics in here are different. It's just closer together. It's more intimate. The topic we're going to be talking about is a really good one. I hope that you guys are excited about learning, and we have some good stuff to talk about. So,
Yeah, we've got toys.
excited.
We got
Yeah.
toys to play with, and so we'll hopefully show you the toys and talk about that. So I'm glad that Brian's here. Brad's an awesome, Brian. I've been with Brad too long. I'm sorry.
Do you want to
forgive me?
twist that knife in my back a little bit there? Okay,
Yeah.
thanks.
So I'm glad that Brian's here. Brian's a great therapist. He's been doing this for a long time. So.
Hey Brad, if you're watching.
Okay, so we're talking about headaches and neck pain. I think we'll get started. Hopefully we have people on here that we can talk with you about, and we're not just talking to the universe. So headaches and neck pain, that's what we're going to be talking about. So you know, we have a little cartoon here that we would like to show you maybe, but it says, when I get a headache, I take 2 aspirin and keep away from children, just like the bottle says. So, you know, the bottle says keep away from children. We hopefully we teach you some things and we talk about things today so that you're not going to have to keep away from your children. I've got some amazing kids. I know Brian has some awesome kids, and we don't want you to have to be away from your children. A few facts about headaches. You want to take some?
Sure, yeah.
Okay.
So, surprisingly, because I looked at this presentation earlier, and the thoughts that come to my mind is, I would think that low back pain would be like the biggest thing that causes people to go to the ER, but it's actually like 75% of the people have had at least one headache, and 30% of the people have migraines. Now, I think we're going to talk about it here in a minute, but it's a really interesting distinction between migraines and headaches, regular headaches, and I think that we sometimes don't know what a migraine is, and sometimes we call a headache a migraine, and so it'll be fun to kind of talk about that a little bit too. So.
Pretty interesting to know that so many people go to the ER though because of headaches and headache-related problems. So what do we have next on here? So just some dollars and cents. Over $4 billion are spent each year on headaches and migraine-related problems. That's a lot of money, $4 billion. And employers lose an estimated $50 billion each year due to headache problems. So this is not just, you know, some small random whatever. It really is a pretty big issue that goes on and that society deals with. So if you think you're the only one that has a headache, don't think that you're alone. There are a lot of people out there that have headaches, that suffer from headaches, that suffer with migraines, and that's what we want to talk about today, and hopefully we can teach you some simple things that you can do to help resolve what's going on.
So let's talk a little bit about some terminology. There are, like I was just mentioning before, there are different types of headaches. So I'm going to throw out a few acronyms and then I'll kind of tell you what they are. So ETTH, so that's a tension type headache. It's episodic. That's what the E stands for. Chronic tension type headache, that means you're not just having it once in a while. This is something that's happening pretty regularly. And we see lots of people who have this problem, and it's continuing to be a problem, and they just they don't know what to do. And at this point too, when it becomes chronic, you'll also start to lose just a little bit of your self-identity because you're just like, I'm in so much pain all the time. that I need to do something else. Cervicogenic headache, that typically is where you have other factors going on, and I'm just going to throw this out there. There have been some long haulers from COVID-19 who I think still have some cervicogenic headache symptoms. So it can come from illness, it can come from muscle tension, it can also come from problems that are not exactly the typical cause of headaches. Migraine headaches, the difference on this one is think about the other symptoms that kind of go with migraine. So there's the photophobia, where you're seeing different kind of lights in your vision. You also will get really sensitive to bright lights. You'll see different spots in your vision as well. So migraines, they're usually a little bit more severe, and there's some other factors that go with it. And usually between your physical therapist and your physicians and providers and so forth, migraine headaches can be diagnosed. The last one is a post-concussion headache, and I see a lot of these. I don't know if you do too, but I see a lot of post-concussion that actually go undiagnosed as concussions. But they come to us as headache patients instead. And I'll see a lot of even people who are in motor vehicle accidents, and they'll not realize it, but when you have a whiplash type injury, your brain inside of your head is sloshing forward and back, and that causes what's called a coup-contre-coup concussion, and that can actually be an undiagnosed concussion that happens during a whiplash injury. So anyway, those are some of the types of headaches that we will see.
So lots of types, lots of causes. We're not going to be able to deep dive into all of those tonight. We're really going to be hitting high surface level stuff. But maybe you've heard or you've been diagnosed with one of those types of headaches. And those are the things that we're talking about and that we can work on and that we can address here. A common factor with a lot or most headaches are stress. You know, does your stress come in the morning, or does it come at night, or is it all the time? You know, there can always be a little bit of stress that's there, that's going on, that can affect us, and that can impact your headaches and how you're feeling. So, problems that cause headaches, lots of them. So we talked about stress. It can be occupation. Maybe the job is not the greatest job in the world, and so that can contribute to it. Maybe you're in a high pressure job, and that can cause the stress that can feed into and perpetuate the headaches that you're having. Life, and what kind of habits do you have? What's your diet? What are your eating habits all about? What's going on with the muscles? And the muscles kind of relate back to stress. We're going to talk a little bit about posture, and we're going to talk about how your muscles overworking or underworking can contribute and feed into the whole headache issue that's going on. Trauma. Brian talked about a motor vehicle accident. Did you fall? I mean, maybe it's a simple fall. If you're not 18 anymore, like I'm not 18 anymore. What? I know. You're not far behind me.
Okay.
If you're not 18 anymore, what we used to do when we were 18, now we can't do. And so you can have trauma from an accident, from a simple fall, lifting your kids or grandkids. Sometimes you don't do it right, and that's going to feed to or can feed into the headache and what's going on there. And then sports injuries. Are you a mountain biker? Are you a climber? Are you a water skier? And then even concussion. So Brian touched on that a little bit.
So we even see some of that out because we do a lot with Grantsville High School, and some of the athletes there will see female soccer players who will actually be affected by sports concussions as well. So lots of different things that happen. So let's talk a little bit about some anatomy. So
where do you want Captain Jack?
right there.
Right there?
Yeah, it's beautiful.
Okay.
So you can see that there's some really good normal, what we would consider normal curvatures in the spine. And you can see there's a little bit of a forward curvature, a backward curvature, and a forward curvature again. And we have fancy names for those. I won't tell you what those fancy names are, but it's something that we're looking at as well as other providers, we're looking to see what those curvatures look like. In addition to that, we have muscles that are around that area that can play on those curvatures. So when they become tight or spasmed or super angry, it can cause different muscles to pull on those structures around it. And oftentimes we'll even see tension that comes at the base of the skull into the suboccipital muscles, the cervical paraspinals, the levator scapulae, which goes between the head and the top of the shoulder, even into the rhomboids and then the trapezius. All of those muscles can be affected by any kind of trauma or other things that we talked about. Now we're going to talk a little bit more about posture here, but just think about those muscles I just mentioned, and then if you are a person who is sitting like this or standing like this all day, you can see that those muscles are going to be hanging on for dear life. So they're not going to be able to withstand that, so they're actually going to start to spasm or tighten in order to get your body into a quote-unquote better position.
So not only are we talking about muscles in the back, but the muscles in the front. So, you've got your pecs in the front, and like Brian showed you, and think about if you've seen any teenage girls, what do those girls look like? They look like this, right? And I don't know what it is about teenage girls, but that's what they do, teenage girls. And so we'll talk about other situations and scenarios, but as those muscles in front get tight, there's lots going on. There are a lot of components and a lot of features involved in those muscles, in the bones, in the anatomy, and working with those.
The other thing that's really interesting is, if you start with headache and tension in the upper body, it can actually start to affect other parts of your body as well too. So the headache might be the hammer, but you might actually get nail down in the lower back and or into the pelvis and even into lower extremities or upper extremities. So, all right, so most common denominator. We've touched on it already. We're going to hit it with a hammer now. The most common denominator, Brady, do you want to guess?
Weather.
Weather. Come on, seriously? All right.
Sherry, what's your guess?
Sherry?
I have no idea. Posture. It's posture.
It's posture. So we're going to talk a little bit about this bowling ball that's our head. So you can think about our head being like a bowling ball. It's about 10 to 18 pounds. It sits on top of our body. If we take our head forward even a few inches, it increases the amount of weight. So I have this fun poster. Do you guys have that poster in here?
The one about,
It's about
1 inch for 10 pounds?
1 inch is 10 pounds, yeah.
I don't have the poster, but yeah.
Yeah, so it's a really good one because I'll have people, almost all the people who come into the clinic will look at that poster, and it's a poster that says your head weighs 18 pounds on top of your body, but when it gets out in front of you, it's 42 pounds. So you're talking about this posture, if you're on your computer, right? And you're talking about that weight. It's not that your head actually changes its mass because it's always going to be 10 to 18 pounds. Mine's more on the 10 side. John's got so many brains and he's so much brain. His is like 18
baby.
pounds. Yeah. So it can be as high as 42 pounds by the time it gets out in front. That's the amount of pressure on the low back, on the upper back because of the head being forward in that forward posture.
So hopefully you can see that and you can appreciate that with what I've got going on here. If this stick were to represent your spine and if this ball were 10 pounds, pretty easy to keep that ball on top of the stick. But if that stick goes forward just a little bit, hopefully you can envision that it's going to be harder to keep that stick in place. And the further it gets forward, the harder it is to keep that ball in place, and the more those muscles are having to work in back to just kind of keep you moving and keep you functioning. So hopefully you can see that with this demonstration.
So I think the other thing to bring up, and this is not only true for kids but also for adults. Did one of you guys come in with a purse today? Yeah, can I see your purse? One of you? So I'm going to show you a backpack really quick, and some things to think about. And I know school year is wrapping up, but this is some good information to kind of tuck in the back of your cap to think about for your students for next year. And okay, here we go. She's got the gold bricks in here today, I think.
Gold or
Oh
platinum?
my gosh, it's gold.
Okay.
All right, so just imagine, and I'm not too
Too
proud
manly?
too proud to wear this thing, but okay, so imagine this. This is probably, if I'm guessing, here you try that out. I'm guessing probably 18 to
Too
20
much.
pounds is
Yeah,
what I'm guessing.
easy.
Yeah. So 18 to 20 pounds, okay, think about this being on a shoulder, and now if you're already in a poor posture and that's pulling down on that shoulder, what's it going to do to these trapezius muscles? It's going to make them have even more tension. Backpacks, I did some quick math before we started. If you usually it's about 20% of the body weight is how much the backpack should weigh. So if you have a 150-pound person, that means that this backpack shouldn't weigh more than 30 pounds. If it is weighing more than that, again, think about posture and how it's pulling, and it's pulling back like this, and you're like this, because you're trying to walk still. That's really going to be pulling on those neck, the cervical paraspinals, the trapezius, those muscles.
Going to deviate a little bit with the backpack. So yeah, the school year's coming to a close, but think about your kids. So, you know, my son, he's 70 pounds maybe, dripping wet. And so if it's 20% of his body weight, so his backpack should be no more than about 14 or 15 pounds. I would wager that most of your kids' backpacks are much more than that. So when fall rolls around next year, stick your kid on the scale, get a feel for how much they weigh, and then figure out the backpack. So other things that feed into this posture, sitting at the computer. Our society is horrible, right? We're sitting at the computer, we are on our cell phone, we're reading a book, we're driving in a car, we're sitting in our cushy chair watching TV, channel surfing. So all
You
of
do that
those
pretty good.
channel surf?
Yeah.
I do that.
Yeah, you're
I do
good.
that too well.
Yeah.
Too well. So we're just in this position, right? And I'm over exaggerating, but we're in this position a lot, which is not where we should be. That's not what our body, that's not how our bodies are made. We need to be more vertical, more upright. One thing I am really good at doing is shoveling in food, as my Buddha belly shows. My wife is an awesome cook. So all these things feed into having not so awesome posture. And as we're not having awesome posture, then we're going to be able to feed into this cycle that's affecting the headaches. You want to chat about cars?
Yeah, so let's talk about seat positions. So here's the bad part of riding in a car. As I was driving out here today, this car comes buzzing on by. It's got a loud muffler. I'm not gonna stereotype, okay, but the seat was back. He was riding like this. How's that posture looking?
It's awesome. It's beautiful.
Yeah, no.
Thumping with the homies.
So when when you have that seat back, it causes a curvature in your spine. The head rest is then typically back. It's not going to be supporting the head. It is called a head rest for a reason. Your arms are going to be stretched out in front of you. The posture is really going to be terrible, and it's going to contribute to all of the other things you may have done in your workday. So again, we got to think about all aspects of our life. We can't just hone in on one thing. We've got to think about everything, especially if this is what's your problem. So back to the car. If we put our seat in an upright position, we have the headrest close to our head so that we can actually be in a good posture and use the headrest like it's supposed to be used, and we keep our body close to the gas and the brake pedals and the steering wheel, and we can actually use our hands in an 8 and 4 position rather than the 12 o'clock or the 6 o'clock. Then we can be in a much better posture as we're in the car. Anything else you want to touch on that?
I drive my wife crazy because I have my seat up, and so when she gets in the front seat after I've been driving, she'll slide it back and she'll recline it. And every time you go have your car worked on, I'm willing to bet when you climb in the front seat, where is it? All the way back. And usually it's reclined. And so I always find myself having to readjust and slide a little closer, have the back upright so that I'm in that better position. So I'm not just, again, perpetuating that posture, that bad position.
I just chalked that up to me being vertically challenged, and so everybody else is taller than me, so.
Personal problems.
Yeah.
Did I say that out loud?
You sure did. Okay, so I think that we've talked a lot about posture and things that go that can go wrong. Let's actually maybe Brady, if you'll go forward again. Let's move into. Oh, do you want to talk about this upper cross?
We
Just for a
kind of
quick
touched
second.
on it a little bit already, but upper cross syndrome you might hear, but that's when muscles in the back are weak, muscles in the front, your pecs are weak, and they're overpowering other muscles that need to be really involved in keeping you upright. We talked about it, touched on it earlier, so I think that we've probably pretty well hashed that out.
Yeah. Okay, so how can physical therapy help? That's why we're here, right? So let's talk about first things first is posture. So what can you do? I think that one of the things that we can do is we can get a good history from you when you come in to see us. We're going to find out what the frequency is, what the duration is, and the intensity of your headaches. We want to know the things that trigger your headaches, like things that you've noticed throughout the day. And if I'm honest, you're probably not going to know that answer when you come in to see me the first time, but you're going to become aware and you're going to start to pay attention to those things. So if you are a person who is watching this video right now, start to think about or pay attention to what is causing and what time of day and how it's happening, and if there are certain things that are going on in your life at that time that is causing it to come on. We're going to look at, we're going to get some baseline measurements on your range of motion. We're going to look at muscle tension to see what those feel like. We're going to look at your posture. We're going to look at trigger points. So we're going to look at things that we can do to teach you as far as stretching exercises go that's going to help to lengthen those muscles. And then manually what we can do with our hands or with other assistive devices that we can help to reduce the muscle tension that's causing your headaches.
You can skip forward a couple more, Brady. Okay, so trigger points, relaxation. We'll teach you stretching. So here's one that you can do. We've talked about it before if you've dialed into any of our videos. But you can do a simple stretch to the side. So upper trapezius stretch. We've talked about that a little bit tonight, that the upper trapezius is often involved with your posture, and you can just bring that ear to your shoulder, so you don't want to necessarily look down, you don't want to necessarily look up, just take that ear to the shoulder, and you want to hold it there for about 30 seconds. So a good 30-second hold is going to give you a therapeutic release of those muscles and help minimize some of the tension that you might be feeling. You can do it each side, 2 times, 3 times. You don't need to really do it more than 3 times for 30-second holds. And you can do that 2 or 3 times a day. Figuring out what is your stress, what's going on in life. Food can sometimes figure into that. Hydration. We did talk about hydration. So making sure that you get enough water, and this is across the board, but it seems to be really, it exacerbates things and really stirs things up more with headaches and with posture. But you should be drinking 1/2 to 1 ounce of water per pound of body weight. So I want to ask you, are you drinking that much water? No, Sherry's shaking her head.
It's because all she drinks is coffee.
Okay, caffeine is a diuretic. Caffeine makes you pee. So then you probably should make sure you drink even more water. So we're gonna do a little math here. So 1/2 to 1 ounce per pound of body weight. So if you weigh 150 pounds, that means you should be drinking 75 ounces to 150 ounces of water per day. So Nalgene bottles, those are pretty common. Everybody knows what those are. Those are about 32 ounces per bottle. So 150 pounds, 75 ounces, that's 3 Nalgene bottles per day. That's if you're 150 pounds. So if you're challenged like I am, I need to be drinking more, right? I need to be drinking more. We all need to be drinking more. So water and hydration is a big component. Anything else you want to say about that? No? Okay.
That's great. We just talked about that, so can we move on to the next one? Perfect.
I do want to touch on one thing that was on
Sorry.
that slide. So headaches are more common in women than men. And that's because women and COVID, right? We're coming through COVID, and how has COVID affected the women in our lives? We talked a little bit about that in our Mother's Day video that we did, but women, you need to take care of you. You need to take care of you, especially when you're challenged with headaches. Make sure that you give yourself time and that you take care of you.
I think that's such an important thing. I think that moms and women in all aspects of of our lives tend to put others first, and we got to. You have to take care of yourself, and you can't benefit somebody if you can't take care of yourself. And if you take care of yourself, you're gonna feel better. You'll be able to do more.
Yeah.
So. All right. Okay. Good stuff. Now we're going to talk about some things that are helpful. This here is an achy breaky. I really like these because we can use ice. Ice can be your best friend for headache treatment. And the thing that's nice about the achy breaky is it can sit at the base of your skull. Remember we were talking about those suboccipitals and even the tension headaches that we can get up into the back of your skull. So you can do something just like John's doing right now. You can have that, and you can put the ice where you want it to be. Now it's kind of counterintuitive because most people will think that if I put some heat on it, it's going to help it. And the ice actually tends to be a little bit better as far as treatment for headaches. So using ice or achy breaky or any whatever you have, using the ice on your head. I've even used in the clinic previously, I can't remember what we call it, the headache protocol. And the headache protocol, sometimes we'll use the heat on the back and ice on the head for the headache patients. And it actually ends up helping to reduce the tension through your back, but then we get the relief of the headache as well. Other things that we would do in the clinic, we would use myofascial release. And that's where we're actually taking the muscles and we're trying to elongate them and allow them to relax. And this isn't necessarily an aggressive thing. This is more about allowing those tissues to open up and be movable again. So think kneading dough and stretching the dough out. That's kind of the thing you need to think about with myofascial release. We're going to use relaxation techniques. We're going to talk about breathing, and we're going to talk about belly breathing. And people don't belly breathe anymore. When you were a baby, if you've ever watched a baby sleep, their breath comes from here. It comes from here and it comes right up and it comes back in, and it just fills up and it goes back out. So belly breathing. So taking time to fill your lungs all the way up and then releasing all of the air out of your lungs. The last thing is we'll use things like spinal mobilizations. In our world, we call them mobilizations. In the chiropractic world, they call them manipulations. So we're gonna do some things that will help to correct any not deformities, but malalignment of the vertebrae throughout the neck. We okay? We got technical difficulties?
Do you have any questions?
Yeah.
Okay.
Do we have any questions so far?
Okay.
No questions?
You're good.
Okay, good.
All
All
right.
right, go ahead.
Okay, other things we'll do here, we'll do some traction. We can do it manually, or we can use some mechanical traction devices, and we have some that we can get you set up with at home if we feel like traction is going to be helpful. We do dry needling. So these are acupuncture needles, but we use the acupuncture needle, that's the tool. But we use it a little different. They're pretty teeny tiny. I don't know if you can even see those on there. That's how tiny it is. I'm a guy that really does not like needles, but they're easy enough that I can stick it in myself, and it's not a big deal, but very, very helpful tool that we have. We use taping techniques. So most everybody has heard of KT tape, right? That's what the volleyball players wore on their shoulder. That registers with everybody. But if you look across the sports realm, the sports world, Kinesio tape, KT tape is used a lot, and that's one thing that we can use in various ways. At the base of your head, between your shoulder blades, we can use it in a lot of different ways. But this is a treatment technique that we have that we can use that can be super helpful. We'll teach you about different programs. Aquatic exercise is something that we can talk about. So there are a lot of different tools, a lot of different things that we can use to help you if you are having headaches and these problems with your posture.
Even regular cardiovascular exercise can be a stress reliever, and it also can help with blood flow through all of your body. You know, sometimes even in the clinic, I'll teach people to do shrugs. So like when you're driving your car, it can be stressful as you're driving your car. You can do the upper trap stretch really easy in the car, but also shrugs and squeezes in the car is really good too because you got blood.
Show us.
Yeah,
Show us
so
the squeeze.
So if you're shrugging up, and again, you can be driving along the road and you're just doing a shrug, but you're also doing a squeeze back. And that's just two things that happen there. You open up the chest like we were talking about before, but you also just get some blood flowing through the rhomboids and the middle trapezius and those muscles in that area. And it's simple and it's easy and it's effective. Sometimes we'll talk about doing posture checks in the clinic. So we'll do an hour timer or an alarm or something like that on your phone or your watch, just to remind you to check your posture. And it can be a little bit annoying, but if you do it for a period of time, then it becomes subconscious and you just automatically do it.
So something again that you can do easy. He talked about shrugs. How many times would you have somebody do the shrugs?
So I typically will have, 30 is a favorite number, so I always just do 3 sets of 10. So
Okay.
when in doubt, do 30 of them.
How about the shoulder blade squeezes?
Same thing.
3 sets of 10. What are you looking for when you do a shoulder blade squeeze? Do we want it coming up to their ears?
No.
What do you want it to look like?
So we want to maintain a lower shoulder so it's actually coming through the scapula itself, so it's coming to and squeezing those shoulder blades together.
See how he's pinching those together?
Yeah.
And you can, it's really interesting to me how many people that we see that have neck problems, headache problems, that really controlling those shoulder blades, it's a hard thing. It's a difficult thing for them to do. And so I'll have people look in the mirror at first so that they know what it feels like. What does it feel like to bring your shoulder blades back and together? You know, if you're doing this kind of a thing, that's not really what we want. We don't want it going up and back. We want it going down and back. And so learning what it feels like, then you can start to implement that maybe when you're not in front of the mirror.
Okay, sitting. So proper sitting techniques, and we talked about, you want to show the think posture.
Yep.
So we just wanted to show this screen shot of where your screen should sit, how your seat level should be, even how your feet should sit on the floor. And sometimes your workstation doesn't allow your seat to come down enough, so then you have to think about putting something under your feet to bring your feet back up to you. You should have about a 90-degree angle at your hips and knees and your feet down, but then you should have a good distance from the screen, so you're not having to look forward in order to be able to look at the screen. There's you know, some real value in paying attention to how your workstation is set up. A lot of the bigger corporations, and you may not know this, but a lot of bigger corporations have a person who has been trained in ergonomics, and they usually can come in. If you're getting headaches, that's probably one of the areas one of the people you should be talking to is your employer about, hey, I think this is part of the reason why I'm getting so many headaches. Is there anything that we can do?
So standing is kind of the same thing. You want to make sure that your elbows are not too low, not too high. You want to have them at about a 90. And then there's some positioning between your sight and where your screen is, and your screen shouldn't be too high, it shouldn't be too low. Again, if you talk to the people at your work that have been trained in ergonomics, they can help you with the sitting or your standing station and what that should look like. We've talked about ice already, we've talked about that, we've talked about that. I think we're pretty through
Yeah,
a
it's
lot
pretty
of
close.
that. Let's talk about the band.
Yeah.
So a lot of people have some type of exercise band, or you can pick one up at the store. So the next phase of just setting your shoulder blades and controlling them is then starting to have some resistance. Will you hold on to that for me, Brady? So you can hook it around your doorknob, or you can close it in the door, and then you're gonna pinch those shoulder blades together while you have some resistance. And you don't want to get too carried away too fast. But again, you can do 3 sets of 10. You can increase that resistance, thanks Brady, to start to strengthen those muscles between the shoulder blades. Those are some of the weak muscles. When we talked about a lot of tension on the traps, the pecs being really tight, the muscles between the shoulder blades are weak, and so we want to strengthen them. And there are a handful of different ways, but that's an easy one that you can use to start strengthening between the shoulder blades.
Okay. Let's see. Anything else that we need
No,
to?
I
we
think
need
we
to
can
hit?
pass. We can move on from that. I
Yeah.
think we've covered pretty much everything. There are different. We can recommend different pillows, different seating positions in behind chairs, pillows behind chairs. So those are things that we can direct you through and help you know what might be helpful or what might help you at your workstation or even at night. There are different glasses that we can get for you that might help you. But hopefully, when everything's said and done, we've got those trigger points released. We've got your muscles strong where they need to be strong, flexible where they need to be flexible, and hopefully you're not just going for an injection. Hopefully you're not just going for medication. Now that's great in the short term. That's a great temporary fix. But is it really going to fix you and help things over the course of your lifespan? And so, if you're a 20-year-old guy like I am, then you got to fix it now because you've got a lot of life ahead of you. Sherry's laughing at me. She doesn't think I'm 20.
Oh, she's laughing at the big eyes that I made.
Is that it?
Mm-hmm. 20.
So again, we want to try and steer you away from the pain medications, the injections, opioid epidemic. That's been a big thing the last few years. And we have tools that we can enable you and empower you with so that you don't have to rely on those things.
I guess the other part of that too is we want you to own this. It's an unfortunate thing that you have going on, but we can give you the tools. You can manage this. We can help you to get to the point where you're not having headaches all the time. And I'm gonna quote Paul Wardley, who is a great headache specialist and the president and CEO of our company. But you are a co-producer of your own success. So you have to be the one who owns it. And if you'll own it and you'll try, we can make a difference. But you have to put in the effort.
Yeah. So we have the tools. We have some tools to help you. You might come see us or see another physical therapist, and things might feel better, and life happens, and maybe you'll need a tune-up here and there, and need to go back to that therapist or come back and see us. And that's okay. Don't get discouraged because life happens. Life is going to happen. But hopefully we've given you some ideas of things that you might be able to try to start doing on your own. Hopefully we've maybe given you an understanding that there's something more out there than just medications. That's where people seem to jump. And don't be shy to ask. First of all, you can come see us without a physician referral with some insurance plans. There are some that do require a physician's referral. Don't be shy to go to your doctor and say, hey, I want a referral to physical therapy. Whether you come to Rocky Mountain or whether you go somewhere else, if you have problems with headaches and neck pain, come see us, and hopefully we can help you become independent and not have to rely on other things. Anything else you want to say?
I guess just the biggest thing is you don't have to live like this. Like we're here. This is why we went to school. You don't have to live like this, and I feel like that we're a good place to come to get the help that you need, and I think we can help you. So please come and see us, and we'll. I was going to add one more thing. One of the things that John just mentioned was a tune-up, and one of the things that we've been doing that's super exciting, I think, in all of our clinics is the ability to just come back in for maybe that one thing that would help you. So you can do it again without a referral from your physician, but you could just come in and say, hey, Brian, the dry needling really helped. Can I just come back again and do some dry needling? And we can do it a la carte. It's cash pay. It's quick. We can provide the service, and then you can get back on your way again.
Yeah.
So, and then using our hands too to help you and hitting those trigger points and doing different things with our hands. Again, it can be quick and fairly effective, and you can get that tune-up that you need to get back into it, because we know that things just happen. It just happens, and we feel good and we stop doing things, and that doesn't just happen to former patients, that happens to us too. There's things that I do that I'm like, oh man, why did I do that? Why didn't I keep stretching? Or, you know what I mean? And it just happens. So just get back on the bandwagon, and we'll keep on trucking.
Awesome. I think that's all we've got, but do we have any questions out there?
Nope, we're good.
No questions? All right. Thanks for dialing in, tuning in, listening to Brian and I. Hopefully, again, we've helped you out, and we'll see you in a couple of months.
Bye.